All right, welcome to another deep dive.
Hi, everyone.
We're tackling a topic that you guys requested, and it's a really good one, I think.
Yeah.
So we're going to be diving into the world of nursing documentation.
Yeah.
And specifically, kind of comparing the old school tried and true paper records
Right.
with the more modern, sleek
Fancy.
electronic health records,
Yeah.
or EHRs, as
We're often called.
they're often called.
Yeah.
So buckle up because we got some really fascinating research to unpack.
Yeah. It's a really important topic.
Right.
And especially these days, when so much of healthcare really hinges on making sure the documentation is clear and accurate and
Absolutely. Think about it. Nursing documentation isn't just about paperwork.
No.
It's like the communication lifeline
Right.
for the entire healthcare team.
Yeah.
It's how nurses, keep track of a patient's progress,
Mm.
share critical information with each other,
Yeah.
and just make sure everyone's on the same page when it comes to treatment. But with this big shift, from paper to electronic systems, the big question is this digital leap actually improving the quality of documentation?
Mhm.
And so one study that we looked at from the Journal of Clinical Nursing
Oh, yeah.
went head to head with this question,
Okay.
using this special tool to audit both paper and electronic records.
Cool.
So they were really digging deep into not just like, is the information accurate, but, how is it presented?
Yeah.
How is it organized?
How does it look?
All that kind of stuff.
They really broke it down, didn't they?
They did. They broke it down into three main areas:
Okay.
the process, the structure, and the content.
All right.
So we're going to kind of unpack each of those one by one.
Sounds good.
Started with the process.
Okay.
So when we talk about process, we're talking about, does it have the nurse's name,
Mhm.
the date, the signature, all that
So
kind
it's
of
those like
essentially, housekeeping details.
Yeah.
And the study found that EHRs scored higher in this area.
Oh, interesting.
Not a huge surprise, right?
I mean,
Once a nurse logs into the EHR system,
a lot of that's
a lot of that is just automatically populated.
yeah, makes sense.
Yeah.
I mean, it's,
Yeah.
yeah, it's what the electronic systems are good at.
Exactly. They're designed to kind of streamline all those administrative tasks,
Yeah,
which can save time, reduce the risk of errors.
for sure.
But it's important to note, though, that just because EHRs, are better at certain tasks
Mm-hmm.
doesn't mean that they're automatically superior overall.
Right.
Right.
Just because they're good at one thing doesn't mean that
Really?
they're good at everything,
Yeah,
you know?
absolutely.
Yeah.
So moving on to structure.
Okay.
Now we're talking about the clarity and the legibility of
Yeah.
the information. So think about, would you rather decipher like a handwritten note
Oh,
or read a neatly typed entry?
definitely don't.
Or
Yeah.
I think we all know the answer to that one. Yeah.
And the study found that generally speaking, EHRs scored higher in terms of structure,
Makes sense.
which is likely because typed entries, tend to be
Yeah.
more legible, more consistent.
Mm-hmm.
And that consistency is really crucial. When you think about the potential consequences of misinterpreting a handwritten note,
Oh, especially in healthcare.
right? Especially in like a fast-paced healthcare environment
Yeah.
where things are happening quickly.
Uh-huh.
The study even gives this example
Okay.
of imagine a handwritten note where the nurse wrote 10
Okay.
instead of 10 units
Oh,
for a medication dose.
that's scary.
Right.
That could be a problem.
That kind of ambiguity could have serious implications for patient safety.
Yeah, for sure.
Mm-hmm.
Really emphasizes the importance of
Definitely highlights.
the importance of clear and consistent documentation.
Yeah.
Now get ready for this.
Okay.
Because here's where things get interesting.
Okay.
When it came to content,
Mm-hmm.
like the actual meat and potatoes. Yeah.
Of the documentation.
The actual information.
The quantity and quality of the
Yeah.
information that was recorded,
Yeah.
paper-based records,
Uh-huh.
actually outperformed the EHRs.
Oh, wow.
I have to admit, I was kind of surprised by that.
Really?
I was like,
Oh,
really
that's interesting.
interesting.
Yeah.
So there are a few possible explanations for this.
Okay.
Some EHR systems may not have specific electronic forms
Yeah.
that nurses need,
Oh, right.
which could lead to gaps in documentation.
Oh, yeah. That makes sense.
So like,
Yeah.
they don't have the form,
Right.
so they don't.
So they're documenting it.
not documenting it.
Exactly.
Others might make it difficult to quickly find the relevant information,
Yeah.
which could impact the nurse's ability to provide timely and appropriate care.
Uh-huh.
And let's not forget about you know, some of these systems don't have a built-in spell check.
Oh my gosh, yeah.
I can't tell you how many times I've seen
Typos galore. Typos and grammatical errors in EHRs.
Yeah.
And it just kind of makes you wonder if maybe all that clicking and typing
Yeah.
can sometimes get in the way of,
Yeah.
thoughtful documentation.
Of really thinking about what you're
Yeah,
writing.
exactly.
Yeah.
The study even mentions instances of nurses using incorrect abbreviations in the EHR.
Oh, yikes.
So even with these sophisticated electronic systems,
Right.
there's still a huge need for training and oversight.
Yeah, definitely.
It seems like paper records might actually encourage a more holistic approach to documentation.
Right.
The study found that paper records excelled in areas like nursing history, nursing diagnoses planning.
Oh, interesting.
These are aspects that really require the nurses to think critically and kind of paint a full picture
Yeah.
of the patient's situation.
Right.
So it could be that paper records, with their emphasis on narrative descriptions and free text entries, allow nurses to kind of capture those nuances of patient care in a way that the EHRs with their, structured data fields and checkboxes sometimes miss.
Yeah.
Now, it's important to mention that this study was conducted in Jordan,
Okay.
where paper records were the norm
Interesting.
until fairly recently.
Okay.
So those nurses had years of experience with paper documentation.
Right.
And we're just beginning to kind of transition to EHRs.
Sure.
And we all know that the learning curve for any new technology can be steep.
Oh, for sure.
And without adequate training,
Yeah.
nurses might struggle to effectively use EHRs
Yeah.
to their full potential.
Absolutely.
So for our listeners out there, who might not be in Jordan,
Yeah.
do these findings still hold true?
Well, that's a good question.
Right.
I think, while the specific challenges and benefits of each method might vary depending on, factors like resources, training, and even just the healthcare culture of a particular region.
Yep.
The core principles of good documentation,
Right.
those remain universal.
So good documentation is good documentation,
Yeah.
no matter where you are.
Yeah.
Our second source really hammered home this point
Okay.
about the importance of training nurses on documentation, regardless of whether they're using paper or electronic systems.
Absolutely.
Proper documentation, it's essential for patient safety
Right.
and for ensuring continuity of care.
Yeah.
This source highlighted a particularly interesting training approach.
Okay.
It was a workshop that combined, traditional lectures with a method called team-based learning, or TBL.
What's that?
So team-based learning,
Yeah.
it's a really engaging way to kind of get nurses actively involved in the learning process.
Okay.
So instead of just, passively listening to lectures, they're working together in teams, solving problems, applying the concepts that they're learning to real-world scenarios.
Oh, I like that. That sounds cool.
Anything that makes learning more interactive and fun is a win in my book.
I agree.
Speaking of learning, our third source delved into a specific documentation format
Okay.
that's widely used in nursing, SOP notes.
Oh, yeah.
And they were looking at how to teach nursing students how to write these notes effectively.
Okay. So SOP notes, the classic.
Right, SOP notes, a classic for a reason.
Yeah, for sure. They're great.
So SOP stands for Subjective Objective Assessment and Plan.
Right.
And it's such a valuable framework, I think, for organizing patient information
It is.
and making sure that you cover all the bases.
For sure.
So break it down for us.
Okay.
What makes SOP notes so effective?
Well, so you start with the subjective section,
Okay.
which is all about the patient's perspective.
Mm-hmm.
So there's symptoms, concerns, feelings.
Okay.
Then you move on to the objective section,
Okay.
which focuses on measurable data,
Gotcha.
vital signs, physical exam findings, lab result. Then the assessment section is where the nurse kind of takes all that subjective and objective data,
Okay.
analyzes it, and forms a nursing diagnosis.
Mm-hmm.
And then finally, the plan
Okay.
outlines the nursing interventions and goals.
So it's like a roadmap
Yeah,
for the patient's care,
exactly.
all neatly organized in one place.
All in one spot.
What I found really fascinating about this study
Okay.
is that they used peer discussion
Oh,
to
interesting.
help the students learn how to write SOAP notes.
I like that.
So peer learning, I think, is incredibly powerful.
Oh, it is.
When students have to kind of explain concepts to each other.
Right.
And work through challenges together.
Yeah.
It really reinforces their understanding.
It's like that saying, the best way to learn something is to teach it to somebody else.
Exactly.
Yeah.
And think about it from the student's perspective, too.
Yeah.
It's a lot less intimidating,
Right.
to kind of practice these skills and maybe make some mistakes.
Yeah.
In a supportive peer group. Safe space.
Right. Then in front of an instructor.
For sure.
So it creates that safe space, for learning and experimentation.
Absolutely.
Now, before we get too carried away talking about,
student nurses,
let's not forget about those of us who are already out there.
Right.
In the field.
Yeah.
Rocking our nursing skills.
Doing our thing.
Yeah. Does this whole SOAP note thing, still apply to the seasoned pros?
Oh, absolutely.
Okay.
That's where our fourth source comes in.
All right.
A document called ANA's Principles for Nursing Documentation.
Okay.
And this document kind of outlines 6 core principles that are relevant to nurses in all settings and at all levels of experience.
Okay, let's hear them.
Okay.
What are those core principles?
All right, so first up we have documentation characteristics, which emphasizes that documentation needs to be accurate, clear, concise, and complete.
It also needs to be accessible to the entire healthcare team.
Right.
And reflect the nursing process.
Okay. No point in having documentation if no one can understand it.
Exactly.
Or find what they need.
Exactly.
What's next?
All right, so next we have education and training.
Okay.
This one highlights the need for ongoing education to make sure that nurses' documentation skills stay sharp.
Right.
Especially, as technology evolves and new systems are introduced.
Right. We've already talked about how important training is, whether you're brand new or you've been doing this for decades.
For sure.
Okay. What else is on the list?
All right. So next up, we have policies and procedures.
Okay.
This one stresses the importance of clear organizational guidelines on documentation practices. Consistency is key.
Right.
To minimize confusion and errors.
Everyone needs to be on the same page, following the same rules.
Yeah.
What's next?
All right. So protection systems.
Okay.
This one focuses on data security, patient privacy, and confidentiality, which is absolutely paramount.
Right.
Especially with electronic systems.
Yeah.
Where information is constantly being transmitted and accessed.
Absolutely. Protecting patient information is non-negotiable.
Could not agree more.
Okay. 2 more to go.
All right, next up is documentation entries.
Okay.
This one kind of gets into the nitty-gritty of what should be included in each documentation entry.
Okay.
Emphasizing accuracy, authentication timestamps, and readability.
Attention to detail is critical.
Critical.
In nursing documentation.
Yeah.
All right, give us that final principle.
Okay, last but not least, standardized terminologies.
Sure.
This principle encourages the use of consistent language and abbreviations to avoid misinterpretations.
Right.
Think of it as making sure everyone's speaking the same language.
Right. So no more making up our own shorthand.
Exactly.
Or using slang in the charts.
No more slang.
Got it.
Yeah.
It's amazing how much thought goes into something as seemingly simple as a nursing note. After diving into all this research, it makes you wonder, about the future of nursing documentation.
Yeah. Where are we headed?
Right. Are we going to have AI nurses writing our notes for us someday?
Oh, that's a good question.
Right.
It's certainly possible.
Yeah.
I could see EHRs becoming even more sophisticated, integrating artificial intelligence and machine learning.
Wow.
To help streamline documentation, identify potential errors, and maybe even suggest care plans.
That's incredible.
I know, it's really amazing.
Technology is advancing so rapidly, it's hard to even imagine what's possible.
Yeah, who knows what the future holds.
Right, but no matter how sophisticated the technology becomes, I think it's safe to say that human nurses aren't going out of style anytime soon.
Oh, I completely agree.
Right.
Technology can enhance our work.
Yeah.
Make us more efficient and even help to provide better care.
Mm-hmm.
But the human element of nursing.
Right.
The empathy, the critical thinking.
Yeah.
The ability to connect with patients on a personal level. That's irreplaceable.
Well said. It's a powerful reminder that even in a world that's increasingly dominated by technology,
Right.
that human touch is essential.
For sure.
Especially in a field.
Especially in a field as vital as healthcare.
Yeah.
And sometimes, that human touch is best expressed through something as simple as pen and paper.
I agree.
Wow, you've given me a lot to think about.
It's a lot, isn't it?
Yeah, it's clear that this world of nursing documentation, it's full of complexities.
Yeah.
There's no one-size-fits-all answer when it comes to paper versus electronic records.
I think what we can say for sure is that nurses play like a crucial role in ensuring that, that documentation is accurate and clear and compassionate.
Absolutely.
Regardless of the method that they're using.
Whether we're using high-tech electronic systems or, the trusty pen and paper.
The goal remains the same, right? To provide the best possible care for our patients.
Exactly.
And this brings us back to, the listener's original question about the future of nursing documentation.
Right. What's it going to look like?
Yeah, we've talked about AI nurses.
Right.
We've talked about the pros and cons of EHRs. We've even talked about, the enduring power of pen and paper.
It's been a wild ride.
It has been a wild ride.
Yeah.
So to wrap things up, I want to leave our listeners with a final thought to ponder.
Okay.
We've explored a lot of ground today.
We have.
But here's the question I want you to consider.
Okay.
How do you think technology can be used to enhance, not hinder, that essential human element in nursing care?
Ooh, that is a great question.
Right.
Really gets you thinking.
It does.
Yeah, at the end of the day, it's about using technology as a tool to empower nurses to provide the best possible care for their patients.
Beautifully said.
Thank you.
Well, that wraps up our deep dive into nursing documentation.
It was a fun one.
It was a fun one.
Yeah.
A huge thank you to you for listening.
Of course.
And a special shout out to the listener who requested this topic.
Yes, thank you.
We hope you found it insightful.
We hope you learned something.
Until next time, stay curious and keep those brains buzzing.
Bye, everyone.